Everybody drinks. Everybody goes to pubs, and you don't tell them that, do you?
I do. I tell everybody.
I am not a moron, and I don't like being treated like I've got half a brain. I haven't got half a brain, I've got a whole brain, and it functions beautifully.
There, that's where your penis is. That's where you breathe from, and that's where Dr. is showing you.
Exactly.
Oh, dear.
This is just this morning.
I've got liver cancer, not brain cancer. You know, I can still function, and I want to do that. Every day's precious.
Good morning, Pat. Need Iris speaking.
Yeah. I'm just trying to see who else does it.
And your name?
Who else does that thing for you? I'm trying to see which other doctor does it.
Hello. Sorry, I've kept you waiting too long.
It's all right.
How are things?
It's peculiar what happened. I was stung on my arm by a wasp that came in through the window.
OK. So when was this?
It was a couple of days ago. I couldn't move my arm. It swelled up, and then it felt achy all the time. It's still funny, my arm. I don't know whether it's because I'm a funny woman.
Do you want to show me where the wasp stung you? Do you want a hand? There we go. You got that one?
It sort of swelled up there, and it still prickles or something and aches.
Well, nothing's hot or red or angry.
It aches still.
Now, what's happening with the psoriasis? Have you been going to see the dermatology nurses?
I haven't because I've been too busy.
Because they were supposed to see you, weren't they, in the daycare so that they could do your creams for you. It's still quite bad on your elbows, isn't it?
It will go. It doesn't hurt.
What's stopping you from going to see the nurses?
It's because I'm tired. I get tired. I can't sleep at night. I lie awake. We're moving.
Yeah.
And it's awful.
What's happening with your sister?
She's going to the country.
OK.
Retirement home.
And have you found anywhere that you're going to live?
No, I can't find anywhere.
As GPs, we're always taught that we should ask open questions and let patients tell their story, but it can be really difficult when patients bombard you with lots of different pieces of information at once. In a 10-minute consultation, that's really difficult.
So are you wanting to buy something then?
I want to buy a flat for the rest of my life. I'll be on my own with my cat, that's all. My sister doesn't want me anymore.
Oh. So did you ever think about going with her, or do you want to stay in Putney?
I want to be near Morley College, where I give concerts and I play Beethoven, Chopin, Brahms, Rachmaninoff. And I played all my life since I was 5 years old.
OK.
Music keeps you young. It kept me young. My father died of a heart attack in the hospital. I just visited him and he said, good luck for your concert. And it was sad, really.
No, it is.
He said, be happy when you play. And he smiled. That's all.
I'm falling apart, basically.
Right. Oh dear, okay.
The last 4 or 5 days, I think I had an ear infection. My ear was agony.
Right.
And also, I would like you to look up to see what progress they're making towards this hernia.
Right.
And the large cyst I found, and I've had enough.
Yeah.
Do you mind if I have a good look at all the joints on each side?
No, have a look at everything.
Pain when I'm pushing?
Yeah.
Up and down, does that cause pain? Okay.
Yeah.
Bet they fractured a bone in my groin
When?
when they done the angiogram.
Okay. All right. Where do we start?
You have to go in soon.
What?
You know, the doctor's going to look at your ear.
Okay.
Are you going to be a good boy and let him look?
Okay.
Are you going to be a good boy?
Yeah.
Hello.
Hello.
Yeah.
How are you?
I'm well, thank you.
Come, Mommy.
Hello, Matthew.
Hi.
When did I see you last? That was a while ago.
Hey.
It was quite like 10. More like 10.
Yeah, 12 now already. He has got another ear infection, and I only noticed it yesterday evening when we were in church that he had a lot of gunk coming out of his ear. He won't let me touch it.
Right.
He insists that it doesn't hurt, but he quite often does that. I've never been able to be sure whether he's just got a very high pain threshold or whether his communication's a bit off around it.
Cough, cold, snuffly nose.
He's been very tired, but no, not really. No. And it's quite difficult with Matthew because he doesn't tend to develop particularly high temperatures.
No.
And quite often, you know, it's only when you see the evidence of something. I imagine this has probably been quite uncomfortable for him for some time, but it's only seems to be when there's some visible sign.
Can I just have a little look at your ear?
Yeah.
It's a bit of a mess, isn't it? You can't see it, though, can you?
He won't let me clean it or anything.
Can I just touch it with a stick?
Hi.
Yeah, not going to go inside, just on the outside. Get a little bit of that fluid. You look at Mummy for me.
Matthew, look at me.
That's good boy.
Look at me.
Ow, ow, ow.
Good boy, good boy, good boy, good boy, good boy, good boy. Ah, good boy.
Well done. Good boy, Matthew.
I like your jacket, Teresa.
Oh, do you? Well, you're not having it. No, I'm joking. I haven't seen you for a while.
No, we haven't. Have you been well this early?
Yeah, but did you go to get fun
So
one up?
yesterday, I read this. And it really frightened me when I read it.
Oh, really? OK, well, we can talk about that. With this, what scared you about it?
It scares you about people dying, you know, not surviving the operation and that.
Yeah. OK. Did you understand what it's talking about, this
Yeah.
aortic aneurysm? Yeah. What did you understand by it?
Well, because my father had one.
Did he? You said your dad had a problem with one, did he?
Yeah, because he had the operation and 2 weeks after he died.
Did he?
Because he had a blood clot. Do you know if I've got one?
Oh my goodness. You have got a really big buggy, haven't you? Yeah.
Does the airway sound quite tight? Oh dear. Life is hard, isn't it?
All right, okay. All right, dude. Okay, cool. Oh.
Can I just pop this in your ear and take your temperature?
Did you hold your hand quickly?
Just, whoopsie.
Oh, dear.
It's all right.
Poor old you.
Come on, Bubba, please.
You got your hands full, haven't you? Do you want to just give him a cuddle and then I'll just have a look at it?
Oh, come on, Bubba. Come on, sweetie.
Hi, how can I help today?
So we just need to get a certificate of health from his modelling agency.
Let's have a look. She's going to be a superstar, is he? It's nice to see a well baby. I see lots of time seeing grizzly babies. Now, we'll have to ask at the desk whether or not sometimes these things don't technically come under NHS services and sometimes there's a fee.
Oh, yeah. No,
but I'll ask. Can I have a look at your tummy? Lovely, we'll just give you a little once over. Oh, let's have a little listen to your heart. Good boy. Look in your mouth. Good boy, thank you.
Very good.
Magic. Magic. So what I'll do is, I've got no reason to be concerned at all. I will sign this and I will just put it in an envelope and ask you to speak to Nicola, who's currently on reception.
Okay.
Good luck with his stellar career.
Are you still smoking?
I still smoke consulate, cool as a mountain stream.
How many a day?
About 10.
Okay. Any thoughts about quitting?
What?
Do you want to stop?
What's what?
Do you want to stop smoking?
Not particularly at the moment, I'm worried.
I mean, it may not be the right time for you to stop smoking now, but I think it would be important to do it when things are more settled. What about alcohol? Because alcohol can increase your risk of osteoporosis.
I'm trying to cut down.
That would be really important if you try and cut it down so that you're having less than 14
My sister, we
units.
both try and have half a bottle each.
Over what period of time?
On a night.
Half a bottle a night?
We have little small glasses. We fill, and she goes back again and fills.
But if you're having half a bottle every night, that's much
No,
more than...
she has her bottle. I have mine. They are small ones.
OK, but even if you're having... What, do you have the whole bottle?
No, we don't drink... No, we have she has a small glass and she fills it about that full.
Right.
Full.
What we recommend is that you don't have more than a bottle, if you're drinking wine, a bottle and a half a week.
Oh, everybody drinks. Everybody goes to pubs and you don't tell them that, do you?
I do. I tell everybody that they need to not drink more than the recommended amount. The other thing that you need to do is make sure that you're getting enough vitamin D and calcium in your diet.
Oh, I expect you're hungry, aren't you?
Are
Have you had your lunch?
I haven't, no. I've been busy.
Oh. Well, you must come to my flat when I buy a modern flat in Putney and have a meal. I'll cook for you.
Thank you.
Spicy cheese grilled.
OK.
And you put tomato puree, a bit of that, and you make an ordinary tasty thing, and you put few herbs in it, and then you grill it, the top of it.
Sounds good.
And put a gherkin on top.
OK. Right. The things that I'm going to do is, why don't we see each other in a few weeks, OK?
good.
And then you go and see the dermatologist tomorrow about the skin, OK?
Yeah. I better go.
All right.
Thank you very much.
And that's your time of the appointment, remember? So you take that. All right, so you go and see them tomorrow.
Thank you.
See you later.
What do doctors do when they, finish at 12 but then start again at 5?
They either go home if they live close, or they do paperwork, like catch-up work.
This is Dr. Hassas from Putney Mead Surgery. Hi there, I had a message to give you a call, sir.
The work is endless. I was expecting to see you this morning, I think, to check your blood pressure. When we've finished seeing our patients, we've then got to type our own referrals, read all the letters coming back from the hospital. We need to check blood results, review people's repeat medications. The list is just goes on and on and on, and you never feel like you get to the end of your work.
Well, when did all the trouble start?
I tried to ring you yesterday, but you were unwell.
Just give me an idea how long this has been going on for.
Right.
Give me a rough idea.
OK, take care. Bye.
Yes.
So they haven't written to you because you've got one. They've written to you and thousands of other men of your age to see if you've got one. Did you understand what it's talking about, this aortic aneurysm?
No.
No. What we'll do, why don't we draw a picture? So, my drawing's very bad, all right? And that's your body. OK. It's not a very good drawing. But your heart is here.
I think that's your legs, Richard.
Brilliant. Well done.
And
Yeah.
there, that's where your penis is. That's where you leave from, and that's where Dr. Owen's showing you.
Exactly. Exactly. So, this bit here is called the aorta. And normally it's nice and straight like that, like a railway track. Sometimes it can swell up a bit like an orange, and it bulges out. And this is what is called an aortic aneurysm. What they've done is they've written to you to get you to have a scan that just looks at your aorta in your tummy. So it's not saying that you've got an aneurysm. It's not saying that you need an operation for it. You said your dad had a problem with one, did he?
Yeah, because he had the operation, and 2 weeks after he died.
Did he?
Because he had a blood clot on the heart.
Okay.
Yeah.
He had an operation on an aneurysm, did
Yeah.
he? Did he? Okay. But just because he...
But he had a blood clot there.
Did he? Yeah.
So...
Yeah. After operation, sometimes people can get blood clots, unfortunately. But just because he had it, it doesn't mean you've got it. Rich centuries, they have different needs from a lot of our population. From my point of view, I see my role as helping them negotiate the health service in order to use it effectively. Richard, they're not going to do any operations on you. What they're talking about doing is putting some jelly on and having a look. You know when pregnant women have their babies looked at?
I'll be with you.
Oh, is it the same thing?
It is, yeah.
Oh, right.
It's what's called an ultrasound scan. Okay.
It's
Pressure
nothing
off
to
that
do with
area.
your stomach, is it?
No, it's nothing to do with your tummy being big. Okay. Sometimes, if you're very thin, we can feel them, but I think you're a bit too big for us to feel it. I can try and feel it if you like, but it's quite hard to feel. If you've got a bit of fat on your tummy, we often can't feel it.
Doctor, don't say that. He's trying to lose a lot of weight, is he not, Sarah?
I'm not overweight.
Yeah.
No, he says, look, he's laughing.
I'm not laughing at you. But you know your tummy's bigger than mine, isn't it?
Yeah, but it's not that...
He does go to the gym a lot.
That's really good. And going to the gym helps stop things like this. Yeah, that's really helpful.
Can we give you some medicine?
Yeah.
You sure?
Yeah.
Okay, good. So, eardrops, have you had much success with over the years?
No.
No, okay.
Getting anywhere near his ears
Yeah,
is...
so I think, you know, the swab should just give us the bug and hopefully which antibiotics it might be sensitive to.
Mummy. Boy, aren't you?
Mummy.
You let the doctor look, didn't
Mummy.
you? Yes, Matthew.
Down.
Down?
No, down.
Dance?
Yeah.
Are you a good dancer?
He's
Are you?
addicted to Strictly Come Dancing at the moment.
Oh, I'm addicted to Strictly Come Dancing. Who's your favourite?
Football.
Football?
Football?
Yeah.
So who's your team, Matthew?
Fulham.
Fulham?
Yeah.
Excellent.
Okay, fireworks.
Fireworks. Kitty and fireworks.
Yeah.
Your favourites?
Yeah.
Fireworks night's coming up.
Yeah.
We went to see some fireworks last night, didn't we, Matthew?
We're going to watch some fireworks tonight.
No, I'm going to watch the FA Cup.
Oh, sorry. Got the wrong pastime.
Well, yeah, fireworks are for kids, aren't they?
Yeah.
Did you do anything for like fireworks last night?
No, I was too tired. And it was too cold.
Yeah, that's true, actually.
I haven't been to a firework display.
You wouldn't believe what my brother's dog did. They were out. This is last year. A hole through the door. I'm not joking. It's terrible.
When did you get her?
She's 3 months now.
Really? And she's a hearing dog, is she?
Yeah.
No?
Yeah.
No.
She's an everything dog.
An everything dog.
Diabetic dog.
Okay.
So she knows just that.
Really?
The cover.
Yeah.
Very clever.
Brilliant.
Almost as clever as you. Have you got a dog?
No.
I
I don't want one. Okay.
Too pain.
What pain?
Right.
Really? Tell me about it.
The heart. Because I walk in her all the time. It makes me twat. And the walking is there.
Are you getting it every time you walk her? Yeah. Will you take off your shoes and I'll have a look at your feet and your legs? Okay. Let's have a look. And is there any pain when I'm feeling your legs? Does that hurt?
That.
Yeah. Okay. I can feel some veins there, but what we always wonder about is that we know your diabetes isn't very well controlled.
I'm on the wrong insulin. This is why I'm waiting for the referral to go and see the
And I'll ask about that. That's fine.
I sat in an empty waiting room for over an hour. Right? I couldn't get out of the chair. I can't sit down for very long. Right? I am not a moron, and I don't like being treated like I've got half a brain. I haven't got half a brain, I've got a whole brain, and it functions beautifully. And when I said to him, why am I an hour late? And I did do that. Why am I an hour late? And we take a longer time because we care. I don't give a toss who you care about. Do you know what I mean?
Yeah. It can't be that people are upset by every interaction you have with our surgery. That's not fair.
Could you have a look at a mole I've got that's behaving a bit funny?
I've got burns.
Okay.
And then I have a mole here. It's just a bit scary.
Right, how long's that been there?
Over a year.
You can just feel it, can't you?
Yeah.
So it's quite rough in texture, isn't it?
And anyway, you might be able to see it.
Oh, this.
Just looking at it, it doesn't look like anything sort of overly sinister.
I can reassure you that this is not a sinister type of mole.
This is a freckle. Very unlikely ever to cause you a problem.
The things that we do look for in moles, we have an ABCD rule. We look for any asymmetry of the mole, so anything that looks a little bit irregular, any change in the border of the mole. C would be for colour change, so if you're getting darker patches within the mole, then that's something to worry about. D is for diameter, anything that's more than about 6 millimetres. E for anything that's evolving, so anything that's itching, bleeding, anything that feels like it's changing, always come and get that checked out.
Yeah.
Okay. Have a good rest of the day.
Great, you too.
Take
Great,
care.
thank you.
Bye.
What were you thinking we might do about this pain?
Tramadol, actually.
Really? Just painkillers.
Yeah.
We can certainly go with painkillers, but we need to be cautious with you because you are at risk of getting problems with the blood supply to your legs. If you get any chest pain when you're walking, or if you're noticing that when you walk a certain distance you get pain in your legs that settles down when you're resting and then comes back when you start walking again, it's very important that we do get a vascular surgeon to see you to check on the blood supply to that area.
Does it look like it's got to reduce blood supply?
No, not significantly, but actually...
Don't tell me significantly. Does it yes or no? If it was your foot, would you take it somewhere?
Part of my job is to manage risks. I know that you're at a high risk of having problems with your blood supply because of your diabetes, okay? So it's nice to want definite answers from doctors sometimes, but we can't always get them. It's not, is it?
No,
exactly.
just based on the opinion of the individual.
When you came last time...
Oh, God.
Why do you say that?
I'm very flexible. I come here. All I come here for is to get my medicine.
Yeah.
I
There's flexibility on both sides.
Exactly.
All right? I'm very flexible with you,
Yeah,
okay?
you are.
What I would say is Doesn't matter what profession you work in. If someone shouts at you when you're trying to do a good job, it's terribly upsetting.
Right, the reason why I knew that she was talking is that all your muscles here move when you speak, even if you don't move your lips.
I'm sorry, you've obviously had...
I am not stupid. I have an IQ of 156. You know, I don't want to be, and how are you today? I could just feel the hand patting my head. No, you don't talk to people.
All right, we'll leave
And
that.
this, you know what I feel about that.
Yeah. Do you know, when I see you, do you know probably on average how much time I spend with you?
I know.
Yeah.
I don't understand and yet I'm grateful for it.
These are just normal people. We're all normal people, but it just worries me the regularity of it. Abuse within the NHS, I think, is taken very seriously in every practice. But the aim isn't just to tell people off, it's to try and work out why they felt the need to react in that way. And usually you can work with people and find a way forward with them.
It was because I was so stressed. I will apologise to him.
Did you?
No, I will.
Okay.
But I will apologise. And
We'll finish now, all right. I'll get that
sorry.
I'll find out what's happening about that diabetes appointment. Come back and see me in a month.
Month.
Yep. And we'll see how your legs are doing. Right.
I am sorry.
Do doctors get ill? Like,
yeah.
Like, how? They're doctors. Can they just... It must be so weird being a doctor going to the doctor. I think I've had this conversation with you before.
How was your holiday?
Oh, it was lovely, thank you. Very nice. We went to Snowdonia and did some walking. Came back and got a bit ill again, unfortunately.
A doctor got ill?
Yes, quite a bit.
Oh, that's no good. Are you better now?
A little bit, a little bit. I'm usually very well. Last time I was ill was the swine flu, so...
Don't go on holidays. It sounds fatal.
Hi, come on in. Right, so you're here for a refit of your implant.
Yeah.
Perfect. So, is this the first one that you've had in? Yeah, and you've been really happy with it as a method?
Absolutely amazing.
Great.
Couldn't last better. Yeah,
Brilliant.
really good.
And have you had any side effects from it?
Not at all. The first couple of months, I think I was told it has to regulate out.
And then you've just had no periods
Nothing.
for the last 2 and 40
it's been
years.
perfect, and I suffered
Brilliant.
really badly with cramps and everything beforehand, and it's just completely eradicated the whole thing. I haven't had anything, so it's been great.
Fine, so it won't be painful at all. Taking it out can be a little bit fiddly.
Okay.
Because after 3 years, the body can put some fibrous tissue around it as a little sheath.
Yeah.
Are you happy to get on with it?
Yeah, absolutely.
Is it left or right arm?
I'm in here.
You've got it in your right arm?
Just
Okay.
there.
Hopefully that would be straightforward to get out. So what we need to do, I pop you on here. So I'm just going to get everything ready on the trolley. The first thing I'm going to do is just do the local anaesthetic injection. Well done. And once this starts working, you won't feel anything else, I promise you. You will be able to feel me touching you,
But not pain.
but you won't be able to feel pain. Okay. So, can you feel anything? Wow. I'm just releasing the little capsule that I talked about that can form around it.
Okay.
It's out.
Brilliant.
That's pretty quick.
Oh my goodness.
And I can put the next one in.
Okay.
And you will be done. Just put it on a little pathway just along the side of the original one.
Okay.
Done. Wow. Finished. That was really straightforward. You did really well. And this will last you another 3 years until you come and have your next one in.
Come in. Hi there. Mr. Gomez.
Hello, sir. Come on in.
You don't know about me, do you?
No, it's the first time we've met, so no, I don't.
I've been a patient here for a long time, and I've discovered that I had cancer, liver cancer, a couple of months ago, but it's very bad. It's beyond surgery, so I'm going in towards, I think, the end of this month for the chemo. It's going to be a chemo Christmas.
Right.
I live alone, and I'm really struggling with the pain of this. It's extremely painful. It's those I'm taking. They're supposed to be every 4 hours, but I can take them every 1 hour, up to 1 hour if I want them. So I'm taking them every 1 to 2 hours.
Okay.
Sometimes I take them 3 and on the trot, 1 hour on the trot. And then something, but I try not to, because I don't want to build up too much tolerance, because when I get to the end of all this, I'm going to, I'm going to end up taking buckets of it, and I don't want to do that. I've been in so much pain for the last couple of months.
And where is your pain at the moment?
Oh, it's all in this region
on the
here.
side of the liver. Okay.
Yeah, it's all in that region just there.
Okay.
I can't do anything like cooking, getting up, and the other thing is, look, it's my legs. This is all like water. She said it's water.
It does look like water, tight, isn't it?
My feet are like loaves of bread. I can barely get my shoes on. Yeah.
And sometimes when you have problems with your liver, the amount of protein in the blood drops, and then the fluid is just leaking out into the cells, and that's where you get the swelling.
Yeah.
So the idea, I think, probably behind the chemotherapy and all of those things is to reverse some of those side effects of the liver problems.
I hope so. It's, I don't know, See, I'm on my own. I'm taking care of myself.
Right.
So it's very difficult,
Yeah. Have you got any other support around?
At the moment, that kind of support, I don't want that support,
What kind of support?
Like coming around and cooking for me, cleaning for me, doing it. I want to do that myself until I can't do it again. I've got liver cancer, not brain cancer, It's, I can still function, and I want to do that. Every day's precious. I don't want to give it up. I don't want to give up responsibility. I want to go down to the shop and get a loaf of bread.
Yeah.
I want to touch it before I buy it, is it fresh, you know what I mean? And I want to do these things still, and I don't want to take that away from me yet.
No.
That's all I've got, really. The little things in life, which are the valuable things in life,
Precious.
Just take the dog for a walk on Wimbledon Common with the boy, There's lovely little precious things. But you can't do it if you're in agony.
How long were you in hospital for?
2 weeks.
2 weeks,
yeah. They took me in. They said, your bowel's ruptured, basically. I've been walking around with a ruptured bowel for God knows how long.
And how are you managing now that you are home?
I'm okay. My belly's a bit of a mess.
Okay.
And I've got a bit of a hole here.
Okay.
I'm just worried about, because I wasn't told anything about Crohn's disease. I don't know what to eat, what not to eat.
When you've had part of your bowel removed, your bowel absorbs nutrients, and so depending on what part of your bowel has gone, you need to make sure that you're getting all the nutrition.
Hungry all the time. Is that normal?
It can be. It's a big thing for your body to go through, and your body will be working harder, helping to heal everything up, and your calorie demands will be higher. And how are you doing? A lot of people struggle at the beginning with just how it all feels and looks like. How are you?
I haven't got a colostomy.
Have you not?
No.
Oh, I thought you had a colostomy.
No, I just missed it.
Oh, I didn't know that.
Just missed it.
Wow, so they resected your bowel and then...
I'm really lucky, because I think I'd just die if I had to have one.
I thought you had a colostomy.
No,
okay.
That's why I'm worried about what I eat, because that surgery could happen again, and I don't want one.
No. You're doing an amazing job.
Thank you.
So far.
I don't have very long, and I don't know, I'm going through all kinds of negativities,
About the chemotherapy?
Yeah, once I'm in there, I'm wired up, that's it, they got me.
Part of my job as a GP, we deal with people who have terminal diagnoses, and it's always upsetting to be with someone who is going through those stages of life. You have to try and keep that emotion to yourself, and make this the interaction about them.
What are you worried about? What worries you? The agony of
it.
I know the pain there.
I know what's coming. Yeah, I already know what's coming. I can feel it. but with the chemo, I can possibly push me up to a year, maybe beyond.
I'm always impressed by how people find resources within them to face the final days or weeks bravely.
I've got a severely disabled lad. He's blind. You know, I've been his sole carer for the last 16 years.
Right.
It's my son, yeah.
Yeah.
And I need to prepare him because he's acquired brain damage. You know, he needs to be prepared for this one. You know, we protected him when his mum had cancer, and she died, and he was in a mess. You know, so now he's going to have no one there.
Does he have any carers or any?
Oh yeah.
He's got people around him.
Yeah,
okay.
he's with guide dogs. You know, he's got a guide. So
there's all that worrying you.
Yeah.
As well,
His welfare. Yeah, his mental state. That's what worries me. Yeah.
And what kind of support, ideally, do you think he would benefit from?
Well, that's what I mean. I want about a year to sort of watch it. You know, to sort of, I need a year to get him prepared and to be prepared to be on his own now.
Yeah.
You know, there's things I need to settle and take care of. Yeah.
If you have a think, and if there's anything else you think you need help with, or we might be able to help with, could you just give us a shout, and we can work it out.
Yeah.
I'll give you the amounts, more of these both.
Oh, the same again. Yeah.
Yeah. I'll give you a bigger volume.
Yeah.
So that it doesn't run out.
Because I need to get this under control.
Yeah.
The management, pain management. Yeah.
The pain we will get under control. The pain will get sorted. All right. Nice to see you. Give me a shout if there's anything else.
Thank you very
All
much.
right.
Thank you.
Take care now. Cheers. Bye bye.
Come in. Hello, how are you?
Okay.
You're wearing glasses. Oh dear.
This is just this morning. Sunday was kind of okay. It was a bit swelling underneath, and then this morning, swelling even more than this.
So it's got better throughout the day?
Yeah, a little bit. I did take an antihistamine in the morning.
And do you think the antihistamine's made much of a difference?
Not really.
And is it very itchy?
It's not at the moment.
It's just very puffy and swollen, isn't it?
Yeah.
And you're not wearing any eye makeup or anything like that?
No.
Poor you.
I'm also concerned that, the flaky skin bit kind of seems a bit yellowy.
One of our doctors does have a special interest in skin. Let me see if my colleague's available just to get a second opinion.
Is it just on your face?
The swelling is, yeah.
If we give you 2, so we give you the 1% hydrocortisone.
Yeah.
Use the stronger one for a couple of days.
Okay.
Just to get it down, get some of the swelling down.
Yeah.
You're going to have to moisturise well because as soon as that swelling has gone down, you're going to go wrinkly.
Yeah, yeah.
Which is horrid. What job do you do?
I'm a teacher. I've got parents' evening tomorrow.
Oh dear. Do you feel sort of anxious or worried?
I'm not sleeping very well at the moment. Which is very unusual for me. I wake up all the time.
I'm still not sleeping properly. I haven't gone back to work yet because I've got another certificate from another doctor.
Okay.
And I prefer to have another couple of weeks off so I can get my head together and think what I've got to do.
And the problem with sleeping, I don't get sleep at all. Maybe because of the stress, the workload, what I do could be the reason. And tiredness is for the last 2-3 months. I'm really, really tired.
I mean, this kind of gives a good description in some ways of what you've been experiencing. You're finding it hard to kind of see the light side of life and not enjoying things as much as you used to.
That's been quite a stressful few months.
It has been a stressful few months. I can't get through the day. I'm kind of worried.
But small steps, because you've come a long way.
Hiya. Come through, Tony. How are you?
Well, thank you.
You look great. Like the trousers.
Thank you.
They're fab.
Back at uni, so...
Oh, right, OK. What course are you doing again?
English literature.
Right, yeah. I got a letter from Dr.
Ducci, yeah.
Yes. And you're on a waiting list for psychotherapy?
Yes, I'm currently seeing Dr. Healy at the Wandsworth Complex Needs every 3 or 4 weeks.
Right.
When I first found out I was diabetic, it definitely really threw my mental health, and I think I definitely wasn't coping for a period of 6 months, and I think I've got over that phase of, I think it's called burnout, when you stop testing and you stop really trying to look after it, and I think I'm testing 3-4 times a day now. I'm really trying to get a control of my blood sugar.
Yeah. Whenever a young person, particularly that has had a mental health problem, gets a diagnosis of type 1 diabetes, it's a very difficult combination. I haven't seen you when you're unwell with your mental health. And Dr. Ducci's indicated that you've had some really difficult times in the past.
I lost my mum when I was young, and I was initially born in South Africa, and now I'm at 15 social services intervened, so I've pretty much looked after myself since I was 15. So that's probably a lot of the issues. It was very early independence.
And were you very vulnerable at that time?
I think so. I think asking any 15, 16-year-old to look after themselves is a big thing, but I wouldn't have changed it because I'm here where I am now. And
brilliant.
Yeah.
I know from my experience of being a patient how much courage it takes to come and sit in the chair of a patient. It would have been about 15 years ago. I had an eating disorder throughout medical school, and it happened at a time when I was a single-handed GP running a practice on my own. I had 3 children under 5, and I was working very long hours with very little sleep. It was very difficult to sit in that doctor's chair day after day, year after year, telling people to look after themselves when I was crying out to be looked after myself. I think you're very self-aware, and you're obviously resourceful, built self-reliance. But just let people in as well. I went downhill pretty quickly until one day I could only get halfway to work and decided I couldn't do it anymore. And that's when we called our own GP and asked for help.
Is that everything?
Yeah, I think it is with me.
Yeah. Have a good day.
Thank you very much. Thank you. Bye, Tony. I've come through. I'm able to truly accept that illness is not your fault. And doctors are patients too sometimes.